And welcome, everyone, to our NCAA social series. This is our third installment dealing with COVID-19. I'm Andy Katz, pleased to be joined by Dr. Brian Hainline, our NCAA Chief Medical Officer, as well as Dr. Carlos Del Rio, a professor of medicine at Emory University, and of course, specializes in infectious diseases. I want to start with you, Dr. Del Rio. Your involvement here on the advisory panel with the NCAA. Let's just go back a little bit here. Over the last couple of weeks, we've been talking about this. As you now look back, how important was it in that 48-hour, 72-hour period to make sure that all winter and ultimately spring sports were canceled?
Well, I think the first thing you can say is that we'll learn a lot, and this is an unprecedented event, and therefore we have no parameters of reference to know exactly what to do. And I first want to compliment the NCAA for putting together a panel of experts and really listening to public health and asking questions to make decisions. The reality is, when we started having these conversations, the first step was, well, let's go and do it as planned. The next step is, well, maybe we should just do it but not have the games but not have the public. And the next is, well, maybe we should not have it at all and we should cancel the tournament. So I think as we gather more information, the decision changed and the risk-benefit ratio changed. And I think that's one of the challenges in a pandemic, is you're trying to make decisions as information is learned and as information is gathered. So therefore, when somebody says to me, how do we predict the future? I said, look, we couldn't predict what we're going to do 2 weeks ahead when we started meeting about this. It's very hard to predict what's going to happen in the fall, right? This pandemic is changing so rapidly. It's giving us so many different things to react to that I think what you need to be is flexible, you need to be nimble, and you need to be willing to do things that you did not plan to do to start with.
Dr. Hainline, clearly no decisions are going to be made here in April. I mean, all indications are, as Dr. Del Rio was saying, this is a moving target. Things are changing by the hour, by the day, by the week. As NBA Commissioner Adam Silver has made it very clear, no decisions on the NBA is going to be made until at least beginning of May. So how do you deal with the membership, with the coaches, with the athletic directors, and the student athletes who are naturally impatient right now as they're all hunkered down, waiting for any kind of morsel of news, hopefully good news, as to what are the next steps of potentially getting back on the field of play?
Well, I think the key really is to stay in communication with the membership. So we've had several calls and webinars, be that with the athletic directors, with the conference commissioners, the student athletes. Student athlete advisory committee members are really taking charge and are viewing this as an opportunity for leadership, social responsibility. And then in about a week, we have a webinar that's going to be with all sport coaches. And that will be important, but we certainly had a lot of communication with them in the meantime. And then internally, we have working groups. And these are working groups not only with the staff that look at legislative issues, policy issues, eligibility issues, and also with important committees like the Football Oversight Committee or the Committee on Competitive Safeguards and Medical Aspects of Sports. So we've actually formed several working groups, and we're playing out all of these what-if scenarios. And of course, the foundation for all of those is public health and safety. But we're staying engaged, and then the membership, I believe also, they're really staying engaged with their student athletes and keeping them grounded and keeping them focused.
Dr. Del Rio, how would you advise, athletic directors who are trying to balance that, economic aspect of this with the public health aspect of, they have to sort of be in concert. You can't necessarily go forward without knowing what the public health risk is before you address where you are economically on your campus.
Well, I think the first thing you do is you put safety and health first, because having sick people is more expensive than not having them. And then you stay informed, you stay nimble, you stay flexible. And I think, honestly, this year is going to be really hard. How do you get people back into practice? How do you prevent people from getting sick? I think, this is going to be a really tough year, and I'm not sure I have a straight answer other than saying, let's stay informed, let's keep learning, and let's hope for the best, because the reality is, so far, we have seen some very concerning trends, and I've yet to see ourselves getting out of the woods, right? And how do we get out of the woods without more damage, without more problems? I think that's going to be the challenge for all of us. And I would say let's stay nimble, let's stay focused, and hope for the best. And again, this is not the end of the world. Something will happen.
Well, so Dr. Del Rio, the difference obviously between the NCAA athlete, student athlete, and the professional athlete is the first word in that. They are student athletes, and can't see a scenario where this talk of little sort of bubbles of allowing pro athletes to play. That can't happen on a college campus because they are college students, and presidents obviously want students on if they're going to have student athletes on. So what would be at least some benchmarks that you'd like to see before that can even be considered, where college students in late August, September, maybe even in October could be allowed back on campus?
Well, I think I want to see, you're almost talking about what will it take to return to the life we want to, right? The life we used to have, the life we aspire to have. And I think the number one is you need to have transmission needs to be low. You need to have low number of new cases, low number of hospital admissions. You need to then have testing available and readily available. And then you need to really be ready from a public health perspective to rapid diagnosis, contact tracing, isolation of those infected. And then you need to have some sort of agreement at the community level of what kind of things we're going to do if something happens. In other words, if we start seeing an increase in cases, do we rapidly go for masking outdoors? Do we rapidly go to, closing schools? Do we not allow people over the age of 65 to come to certain events? I think those are the kind of discussions that we're going to have. I think life is not going to return immediately to normal. It's going to return to something that is normal, but it's not the normal we used to know.
Yeah, so to that point, Dr. Hainline, how do you counsel these coaches, these student athletes, and these athletic directors, and ultimately the presidents, of what that new normal, at least in the short term of fall of 20, winter of 21, may look like before we have a vaccine?
Right. So I think the presidents, they're the ones that are really grappling with this the most, because as you mentioned, Dr. Del Rio mentioned, these are students first. So how do we get people to return to campus? And I think those are the principles that are going to be worked out, and Dr. Del Rio really elaborated on them. I think for the coaches, it's really important to go to a different sort of emphasis. We know from really sound data that coaches are the single most important influence on student athletes. And what we hear from the student athletes is that they understand two things. One is they really want to get back to sport, but they also really understand that we're in a crisis that's affecting all of humanity. And this is an opportunity for the coaches to really bond with the student athletes and let them know, yes, this is a public health crisis first and foremost. So we're all in this together. And then we're going to try to get back to sport. We are going to get back to sport eventually. And when we get back there, it's going to be safe. And it's also going to be, an environment where we're not going to hurt one another or get hurt, because we're going to be trained properly. So it's the balancing act for the coaches. They're overseeing the training right now that the athletes are doing. They're doing it remotely. And they have to make certain that when we do return, that the athletes are in good shape. But first and foremost, again, the coaches really influence the athletes. And this is a unique opportunity to really help them understand more profoundly that this is a crisis for everyone.
So, Dr. Hainline, what are you hearing in terms of what could happen for testing, on college campuses, or before students arrive, or even before athletes were to arrive, if they're allowed to, in the late summer?
Well, I think what we're hearing is more speculative than what really exists, because we've actually heard some coaches, some administrators, some students. I mean, a lot of people saying, well, we're going to get back to campus and we're going to be able to test everyone. We're still in this country, and Dr. Del Rio knows this much better than I do, but we're still at a prioritization level for testing. So to really return to a place where you're first doing serological testing, so you understand if someone has immunity, we don't know the validity of those tests yet, and we don't know how widespread they'll be. And for rapid diagnostic testing, we don't have the accuracy of those yet, and that's not widespread. So in terms of the testing, a lot of people talk about it, but we have to make certain the infrastructure is there, that it's reliable, and that especially it's available for the people who truly need it first, and those are the ones that are suffering.
So Dr. Del, at that point, how far away are we from that kind of widespread testing that may be administered at the state level versus at the federal level?
Well, I mean, I think we need to increase testing at all levels, right? I mean, it's not just federal or local. I think we've seen an increase in testing availability, and we're going to see even more. And I honestly think over the next month or two, there's going to be a lot more testing happening, and we're going to be better testing happening. And I think that's going to change dramatically what we do. Let's think about, let's see what the scenarios are play out as we get more testing available in this country, and I think that's going to be very different.
So Dr. Hainline, what's going to be your specific message to football? Because that is sort of the elephant in the room that everyone wants to talk about, because it's the next major sport that would be happening on a college campus. And it's not just the football players, but obviously it's the fan aspect. And we don't know what's going to come first as to what could be allowed. What's your message to the football community?
Well, look, you're right, Andy. Football is the great metaphor, not just for fall sport, but I think for all of sport. And when we think of football, it's not just NCAA or college football. It's not professional football. It's youth football. And youth football provides an exceptional opportunity for so many individuals. It truly is an equal opportunity sport. But we have to get football right. And so we don't want to go on a timeline where we're saying, well, we're going to start football by this date or this date, no matter what, because that's just what's necessary. So the message really is, it's a fewfold. One is there are several groups that are actively working on this, membership groups within the NCAA, and then the NCAA staff, the American Football Coaches Association. And really a couple of things need to happen. One is that from a public health, a public safety point of view, we're ready to re-engage. We're ready to re-engage as teams that are in close physical contact. Then we're ready to engage as teams competing against one another, and then possibly ready to re-engage with fans. But it's not just the timeline of safety from a public health point of view. Football is an aggressive, rugged contact sport. And so if the timeline does shift, we also need to be certain that the players are really well prepared, because we don't want to see all of a sudden a large number of musculoskeletal injuries or overuse or undertraining injuries because we brought the players back too quickly. So using Dr. Del Rio's words about being nimble, we're going to have to be nimble in the football community. And we have a large number of organization groups, membership committees that are actively working on this. And we all want it to happen, and we want to make certain that it happens in a timeline that assures public health is really first and foremost foundational for all of this.
And as Dr. Hainline said, I think we also need to think about, about the athletes that have not been able to practice in team sports, and they have to, not only take care of themselves and avoid injuries, but quite frankly, they're going to need some time to get back into practice and really learn how to work as a team again.
Right.
Dr. Del Rio, I want to pick up also on the point of students back on campus. In what scenario could you see where there could be that phase of, let's say, hypothetically, they are wearing masks, or there is somewhat social distancing, although it might be hard to do, obviously, in a dorm situation, but at least there would be a new phase of getting college students back on campus rather than waiting for this sort of all clear, which may or may not come, in the near future. We don't know when that could happen, where everyone could come back all at once.
Well, I think it all depends. It's really hard to make decisions based on what we know right now. The reality is, I think we're going to have to have we're going to have to see what happens. If we truly do this well and transmission can decrease significantly at the community level, and we can literally make this virus go away, because if there's no transmission, the virus disappears, and we can get rid of the virus, we'll be in a very different place than if we let transmission continue. So the worse we do this, the more likely we're going to have to think about the scenarios that if we don't do this right to begin with, we're going to be suffering more than if we do it right.
And Dr. Hainline, this new normal that, coaches are going to have to adjust to here. What kind of questions are you hearing about what might be allowed? And I know it's still only April, but in a new normal kind of situation, when practice resumes, whenever that is.
Well, I think one part of the new normal is that there's going to be a new cultural norm. And, I've said this before, we've seen this in concussion, where the players really look out for one another. They know that it's much better for everyone's health, the team's health and the individual's health, if you report concussion early. I think there's going to be a new norm about people looking out for one another, not coming into practice if you think that you're sick, and the whole way that of cleanliness. We've seen this in the sport of wrestling, where they really took infectious disease prevention to a great level. And I think that can happen in the sport of football. So it's a whole new awareness of and really an enforcement, if you will, at the local level of how things are done properly. And that involves working with the strength and conditioning coaches, the athletic trainers, the team physicians. So I think you're going to see a whole new type of community engagement around infectious disease, cleanliness, and what makes the most sense.
Dr. Del Rio, what are you seeing in other countries, South Korea, China, where they've maybe started to relax a little bit of their social distancing or their shutdown, their lockdown, but then maybe a little bit of reemergence of some community spread? I mean, what are you seeing out there that might?
I think as you relax community restrictions, you're going to see some community spread. And the question is, at what point in community spread do you re-implement certain measures, right? At what point do you say, hey, we have to go back to this, that, or the other?
And how about flattening the curve? It's obviously something that we have now gotten used to hearing in the last 3 weeks. Getting on the other side of the curve, on one side, that's great news. On the other, we're seeing obviously a high mortality rate here. How do we know when we're down the downside of that curve and at least heading in the right direction, hopefully to having some restrictions being lifted?
Well, I think that's what we're all looking for. I mean, I think that, again, that's what we're all looking for, and we're hoping that we can get to that point. But it's not going to be immediate. It's not going to be, as I said, I hate to say it, but I think that this year, I refer to this calendar year, we may not return to normal this calendar year. I really think that it's going to be very hard to do so without having a vaccine and some other strategies in place.
Well, I think we all agree here. We're definitely not going to be returning to the pre-COVID-19 in the calendar year 2020. It's going to be some form of a new normal.
Right.
So I want to get back to that, Dr. Hainline, because there's so many meetings going on right now in conferences, athletic directors, and everyone wants these answers that you just cannot have in the month of April. And so how do you preach that patience that on April 8th or 9th, what we know is going to be drastically different than on May 8th or 9th or June 8th or 9th, and you're just going to have to wait before you make any decisions?
Well, I think I'm just going to echo a couple of points that Dr. Del Rio mentioned earlier. One is there's been a vast expanse, really an exponential expanse in testing. We're not there yet, and I think 4, 5, 6 weeks from now, we're going to have a much greater understanding of the two types of testing and how well they work. So immunity type verification and then rapid diagnostic testing, and the infrastructure support might be much better. And then the other is, having a sense that you really have contained this virus at the community level, and you're ready to engage aggressively if there is a reemergence. And so, it's understanding, yes, look, we've made so much progress, and people like Dr. Del Rio and others are on the inside of helping to make this progress really blossom. But hang tight. We're all playing the what if scenarios. We all want to return to some type of resocialization. And I agree, it's not going to be a return to normal, but let's be flexible and let's be patient so that we can return to a normal that allows us to reemerge at a society at an acceptable level, really at a socially responsible level.
So let me just put us an example. And again, think about it this way. when people say, how are we going to envision what's going to happen in the future? I take you back in time. Think about what is it going to be like? What was it like? I mean, in January, there was no way we could have predicted to be where we are right now. In fact, in February, there's no way we would have predicted we would be where we are right now. That's how rapidly this has changed. And therefore, think about, go back to those months and say, oh my God, where are we not seeing what we're seeing right now? And that's why I just increasingly get worried about trying to predict the future, because we don't know what the future looks like.
Dr. Del Rio, I want to address the personal protective equipment, which has obviously been in the news a lot lately, and the PPE on the front lines and for our first responders and medical professionals. What we saw, and I'm going to go back to the 90s, if memory serves, at the initial HIV AIDS epidemic, what we saw were athletic trainers from that point forward had gloves if there was any blood, and we changed the way we did things on the court, that if there was blood, stop the game, you clean the surface, certainly in a court versus a field of play, or if you're dealing with a jersey, you had to change the jersey. So blood was dealt with differently in terms of how athletic trainers handle it with gloves all the time. That wasn't the case prior to that. How do you see life changing for the athletic training community in terms of PPE and how they deal going forward once we resume some form of normalcy?
We may need to have more masks available. But again, I repeat that the reality is it depends, right? I mean, I don't think we need to have people in PPE all the time. I think that'll be absurd. We need to see what we need. And I think there may be more masks and more gloves available that we currently have. I think we may be using more gloves and masks and a lot more Purell out there.
Dr. Hainline, from your vantage point, because you're dealing with that community at the NCAA level, I'm just curious, what have you heard from that community, if anything, about how their lives and the way they work may change on a college campus?
Well, they're very concerned. There was a conference call today with a large group of athletic trainers, and right now they don't have the masks that may be needed, and if you're really talking about the proper type of mask when you're dealing with someone who's infected, that's different than a cloth mask. So right now there's a prioritization, and that really has to go to the healthcare workers that are on the front line. So it wouldn't even be ethical for the athletic trainers to have those masks right now, because they're not dealing with the front line. But once we return to this new normal, or this resocialization, then I think what's going to happen is you're going to have best practices or guidance. So if you suspect that someone has COVID-19 and you're immune or you're not immune, there's going to be a different approach to that. I think you're going to see a much wider array of really good sanitizing equipment and all of the athletic rooms and the training rooms and so forth. And so we have to make certain that that's available. But I think what this pandemic is going to teach us is, what are the best practices going forward before we have a vaccine, and then what does it look like after the vaccine? You could maybe look at that as two different points in time.
Absolutely. I think that's right on point.
One other thing here, Dr. Hainline, you mentioned this, I think it was last week in our conversation, or maybe the first week, when we were talking about different fall sports, and cross country is an example, which you could have social distancing literally once the race begins. How much is there any kind of discussion about sports being treated almost, in their own silos as to what could be allowed versus, one size fits all? If college students are back, then we kind of figure out how each sport could come back. How you're balancing the two, because not all sports are created equal in terms of how you deal with these medical issues.
Right. So, again, firstly, it's, are we going to be able to get the students back on campus? And then assuming you have that, well, yes, cross country is very different than football, except I remember the starting lines of cross country, and, my ribs were often bruised, and it's a contact sport at that starting line. But in all seriousness, it really is different. The training is different. It's much easier to do social distancing. So in this working group that we have, it's an interdisciplinary working group, we're looking at all of the fall sports. The core principles are being developed for football, but that is being parsed out, and we're looking at the other sports, women's volleyball, field hockey, soccer. And then you have some sports that aren't traditionally competed in the fall, but they play in the fall like tennis and baseball.
Yeah.
So we have a lot to figure out, and you're right. We're going to take a slightly different approach for each sport.
Absolutely. I mean, they're very different, right?
Yes. And one last thing, Dr. Del Rio, that I do not want to end this without discussing, because we discussed this last week. I want to get your opinion on this, is the mental health aspect for this. I mean, we're all dealing with, having to be sort of shut in, away from other people. And, we're all going to handle it differently. For an athlete, it's really dramatic. It happens suddenly. The way they work out, the way they train is now dramatically different. What would be your advice to those student athletes that now have to deal with the mental health aspect of this as their lives were dramatically changed in an instant?
Well, I mean, I think your life turns upside down. And whenever your life turns upside down for whatever event, it's very traumatic. And a traumatic event leads to anxiety, leads to depression, leads to uncertainty. I think we need to provide schools, coaches, teams need to provide the support necessary, because again, while this is traumatic, this is also not permanent, and we need to help people get through this event. And addressing mental health needs, I guess, is fundamental. I also think it's really important that we keep people healthy, right? I think we need to keep people training as much as they can. We need to keep people fit. And we need to make sure that people are not just sitting in a couch and eating unhealthy food, because then they're going to not only not be training, but actually regress in their physical fitness. So I think staying focused, continue to work towards your goals is a critical component of getting over this episode.
Dr.
Hainline, I'll give you the last word.
Well, I'll just build on what Dr. Del Rio was saying, and the focus is really important. And so the goal setting isn't like, well, when am I going to return at some point in October or September or August? It's what can I do today to make certain that I'm really taking care of myself? And part of that is taking care of yourself physically, mentally, emotionally, even spiritually. And what are my goals for this week? And so again, just like the Olympic athletes, they don't focus on where they're going to be in 4 years. They say, what can I accomplish this week? And it's a building block for the week thereafter. And the other thing that I think is helpful is when the student athletes understand that they're part of a community that is really part of a very large community. Humanity is suffering right now. And to be part of that effort, to feel connected to the human suffering and to find your own solution for that, find your own sense of compassion for that, that also helps from just, a mental health and a self-esteem point of view.
Well, I appreciate both of you. This has been incredibly informational, educational every week that we've done this. It's our third NCAA social series on COVID-19. We're going to continue this throughout the course of the spring. Dr. Brian Hainline, our Chief Medical Officer from the NCAA, and Dr. Carlos Del Rio from Emory University, focusing on infectious diseases, also a member of the NCAA Advisory Panel. And as always, you can go to ncaa.org/COVID-19 for more information on the subject. Thanks for joining us.
Delighted to be with you.
Thank you.